Bismillah ar-Rahman ar-Rahim. I am Dr. Mohibullah Wazir, and the topic is the blood supply and venous drainage of the esophagus. Note, the esophagus partly lies in the cervical region, then it lies in the thoracic region, and the distal part or the lower part of it lies in the abdomen by passing through the diaphragm where it opens into the stomach. Now, the upper part or cervical part is supplied by branches by inferior thyroid artery, which is a branch of thyrocervical trunk, a branch of subclavian artery. While the middle portion, thoracic part, is supplied by the esophageal branches from the bronchial arteries and from the descending thoracic aorta. While the lower abdominal part, it is supplied by branch from the left gastric artery, which is a branch of the celiac trunk or celiac artery. Celiac trunk, left gastric artery, lower part, thoracic branches of aorta and bronchial artery, middle part, while inferior thyroid artery from the supplying the superior or cervical part. Now the venous drainage from the upper part is along with thyrocervical vein to the azygos vein and also to the brachiocephalic vein and then to the superior vena cava. The middle part or thoracic part, it is the venous drainage is again to the azygos and accessory hemiazygos vein and then to the systemic system. While the lower part of the esophagus, at the central tendon and the lower abdominal part, this part is being supplied by the left gastric artery and also by a branch from the left phrenic artery. The venous drainage is over here on one side to the systemic veins and another side to the left gastric vein, and the left gastric vein then open into the portal vein. In this way, in the lower part of the esophagus, there is a connection between the left gastric vein, which opens into the portal vein, and the left phrenic vein, which opens into the systemic vein, and over here is a portosystemic anastomosis. And portosystemic anastomosis is present above the central tendon at the level of T8 vertebra. That's why some people say that the portosystemic anastomosis is in the middle part of the esophagus in the submucosal region. So if the portal vein is being obstructed over here is the liver, and if the portal vein is obstructed over here in the liver, in the cirrhosis of liver, then which is called portal hypertension, then the left gastric vein dilate, and then the esophageal plexus of veins in the middle or lower part of esophagus where there is portosystemic connection, those veins gets abnormally dilated like that. And this abnormally dilated veins in the lower part of esophagus, this is being called as esophageal varicose vein or also called as esophageal varices. And if it rupture, it will lead to a serious or even fatal bleeding as well. And this is one of the signs of the portal hypertension due to cirrhosis of liver or any other disease. Thank you very much.